Okay, we've all been there. A patient walks up to your counter, they look exhausted, frustrated, and they're just desperate for a fix after being up all night with painful leg cramps. It's such a common scenario. So, let's dive in and build a solid playbook for how to handle this with confident, evidence-based counseling.
Right, this is that moment where your expertise is really going to shine. Because it's not just about grabbing a product off the shelf, it's about asking the right questions. So, what's our opening play? Let's break it down.
First things first, before we get into counseling, let's just do a super quick refresher on what a muscle cramp actually is, just to make sure we're all starting from the same place.
You know the signs your patient's going to describe. That sudden, vice-like grip, usually in their calf or maybe their foot, often waking them right out of a deep sleep. And here's the key clue for us, right? They find relief, even if it's just for a moment, by stretching that muscle out.
Now, what's really interesting here is just how many things can be behind this. We all tend to jump straight to, dehydration or electrolytes, right? But the reality is way more complex. It could be anything from a patient's age and arthritis to their medication list or even an underlying condition like liver disease. And that's exactly why our assessment is so critical.
So, with that background, let's get into our practical role right there at the counter. This is where we shift from just knowing stuff to doing stuff, acting as both a problem solver and, really importantly, a critical safety net. Here's your 4-step game plan for the counter. First, just get the story straight. Then, and listen, this is absolutely crucial, you have to screen for red flags. Are the cramps happening alongside any muscle weakness or noticeable shrinking of the muscle? That changes everything. Review their history, and if any of those red flags pop up, your most important job is to refer them to a physician.
Okay, so let's say there are no red flags. Where do we start? Well, the evidence points overwhelmingly in one direction, and it's probably not towards the pharmacy shelves.
I really want you to burn this quote into your memory. Honestly, if you take one thing away from this whole explainer, let it be this. This single sentence is the most important counseling pearl we've got. Before you even think about a product, you need to have this conversation.
And here's what that conversation actually looks like. For relief, right now, tell them to do some gentle static stretching and maybe apply some heat. For prevention, the focus should be on building a daily stretching habit and taking a hard look at their footwear. And you know what? Don't ever underestimate the power of just reassuring them that without those red flags, most cramps are benign.
Okay, but you know it's coming. The patient is going to ask for a pill. This is often the trickiest part of the whole conversation. So our goal here isn't just to recommend something, it's to manage their expectations based on what the evidence actually says. And here it is, the unvarnished truth. We have to be really honest with our patients. There is no magic bullet for this. The evidence is just plain weak. So any medication we talk about is basically a therapeutic trial, not some guaranteed solution.
Before we even look at what we might use, let's talk about what we absolutely should not use. Quinine. It's a total historical relic. If you see it, if a patient asks for it, the answer is a firm, confident no. The risks of serious side effects just completely outweigh any tiny, unproven benefit.
So this table kind of sums up our very limited options. And you start to see the pattern here, right? Magnesium is a go-to for pregnancy, sure, but its benefit for everyone else is questionable. Vitamin B, diltiazem, gabapentin, they all have these small studies suggesting they might help, but there's nothing definitive. And each one comes with its own baggage, like making sure you counsel on the risk of sedation with gabapentin. This is exactly how you frame it for the patient. Look, we can try something, but we need to give it a fair shot, let's say about 3 to 4 weeks, to see if it makes any difference at all. This sets a realistic timeline, and it positions the whole thing correctly, as an experiment, not a cure. All right, now let's pivot to something that I think is really fascinating. For that acute relief, the second that cramp hits, what does some of the most compelling and, frankly, strange evidence actually point to?
Yes, pickle juice. I'm not kidding, and the science behind it is just incredible. It's not about the electrolytes, which is what everyone assumes. The leading theory is that the acetic acid, the stuff in pickle juice, mustard, vinegar, it triggers receptors in the throat, which then sends a neural signal that basically interrupts the misfiring motor neurons causing the cramp. It's like a neurological trick, and it works surprisingly fast.
Of course, not all patients are the same. So let's quickly touch on 2 groups that, show up at the pharmacy counter all the time with this exact complaint.
For your pregnant patients, oh man, cramps are so common. The playbook here is really simple. Stretching first, always. If that's just not cutting it, magnesium is considered the safe and reasonable next step for a short-term trial. And just to say it one more time, quinine is an absolute no-go.
Now for athletes, the advice is pretty similar. When one of those exercise-associated muscle cramps hits, passive stretching is the best thing to do right away. And yep, this is where that pickle juice can be a total game changer for cutting the cramp's duration. And here's a fun fact, while staying hydrated is obviously good for your health, the evidence that it specifically prevents these types of cramps is surprisingly weak.
So, let's wrap this all up. Let's distill everything we just talked about into 3 simple, actionable phrases you can literally use at the counter tomorrow.
Pearl number 1, you always lead with the non-drug options. This phrase frames it in a really positive way and establishes stretching and good shoes as the real, evidence-based foundation of care.
Pearl number 2, this is your go-to script for managing expectations around medication. It's honest, it opens the door for a shared decision, and it correctly frames any pill as a trial, not a sure thing.
And finally, your critical safety netting pearl. This simple sentence empowers the patient to know what to look for, and it reinforces our role as a key part of their healthcare team, making sure they get the right level of care exactly when they need it.
So I'll just leave you with this question. The next time a patient comes to you for help with their muscle cramps, what's going to be your first instinct? Because that answer can fundamentally change the quality of care you provide.